The world of ancient medicine was far more than the healing arts we know today. It was a realm where magic, mystery, and mysticism coexisted, where the boundaries between the physical and spiritual were blurred, and where the art of healing was as much about belief as it was about science. Picture a time when sickness was seen as a punishment from the gods, or an imbalance of spirits rather than a virus or bacteria. Imagine standing at the edge of a vast desert, a flickering torch illuminating the dark shadows of a stone temple. In this world, the healers were not just doctors, they were revered figures, often called upon to communicate with the divine. Ancient healers were believed to possess the rare ability to traverse the thin line between the mortal realm and the unseen world of spirits. As you step deeper into this world, you find that the healing process was not limited to simple remedies. It was a rich tapestry of sacred rites, herbal concoctions, and divine intervention. In Egypt, for example, the famous Imhotep, a man who transcended his mortal existence to be venerated as a god, was one of the first to bridge the gap between medicine and mysticism. His healing methods were a complex blend of physical treatments and spiritual practices. As ancient healers were expected to serve both body and soul, the world of medicine was a space where rituals of purification, divine prayers, and offerings were just as important as the remedies they concocted. Across Mesopotamia, the Assyrians and Babylonians believed in divine curses that could cause illness, but also knew of magical incantations and sacred herbs that could drive these spirits away. Their healing ceremonies were long, drawn-out processes filled with chanting, rituals, and the burning of incense that filled the air with pungent fragrances. As you move westward to Greece, the foundations of modern medicine began to be set in motion, but even then healing still had one foot firmly planted in the divine. In the temples of Asclepius, the god of medicine, priests would guide sick individuals through rituals meant to cleanse their souls. The people would sleep in these temples, hoping for healing dreams sent by Asclepius himself, a form of divine intervention that was still deeply connected to the belief in a higher power. Healing, then, was far from a straightforward process. It was a journey, one that required faith in the supernatural, belief in the healer's powers, and an unshakable trust in the divine. These ancient systems were not simply about curing illness, but were deeply intertwined with culture, religion, and the human need for meaning in the face of suffering. Whether it was through the burning of sacred herbs, the prayer for divine favour, or the mysterious rituals performed in the quiet sanctity of the healer's home, ancient medicine was a world where life and death, science and superstition constantly collided. This intricate, awe-inspiring world, however, was only the beginning. In the coming parts, we will delve deeper into how these practices evolved, and what secrets they may still hold today. Long before the modern understanding of health and medicine, early humans turned to the natural world and the unseen forces around them for healing. These primitive practices were born from a deep connection to the earth and an intrinsic understanding that nature held the answers to their survival. It was not science that guided these early healers, but intuition, observation, and trial and error, steeped in the ancient belief that the human body was a microcosm of the universe. The first healers were the shamans, spiritual guides who possessed a sacred bond with the forces of nature. Their methods were intertwined with rituals and an unshakable belief in the supernatural. Whether in the vast deserts of Egypt or the dense jungles of Mesopotamia, these early practitioners understood the power of plants, the rhythms of the seasons, and the influence of celestial bodies on health. In the Fertile Crescent of Mesopotamia, the Sumerians and Akkadians carved the first medical tablets, detailing their findings on herbal remedies and spiritual practices. These civilizations mark the beginning of formal healing practices, where written knowledge first intersected with ritualistic and herbal treatments. However, these ancient healers were not simply concerned with the body, they treated the soul as well. In Egypt, healing had a dual focus, the physical body and the spiritual well-being of the patient. The Egyptians believed that illness could stem from an imbalance between the body and the soul, a belief rooted in their intricate systems of gods and goddesses. gods like Thoth and Sekhmet were revered for their powers of healing and wisdom, and their followers combined divine prayer with remedies made from the plants found along the Nile. Meanwhile, in ancient India, the practice of Ayurveda began to take form, drawing upon the connection between the elements of nature and the balance of the body's internal energies. This holistic approach to healing centered on balance and harmony has endured for thousands of years, influencing much of Eastern medicine even today. The ancient Chinese, too, developed a sophisticated understanding of health based on balance. The concept of yin and yang and the flow of qi, or life force, became the foundation for Chinese medicine. Acupuncture, herbal medicine, and massage were all part of this intricate web of healing, rooted in the idea that the body was a vessel of energy that needed to be in perfect harmony to remain healthy. But despite these foundational practices, the role of the healer was as much about spiritual guidance as it was about physical care. Healing was seen as a sacred duty, not merely a profession, and often healers were thought to channel divine powers to restore balance to the sick. From the Egyptian temples to the ancient Greek sanctuaries of Asclepius, healing was more than just a remedy. It was a spiritual journey. The healer's role was that of an intermediary, connecting the patient to higher forces that could help them recover. Ancient medicine was a complex web of knowledge passed down through generations, where intuition and mysticism met the natural world, and the healing arts were intertwined with faith and religion. These origins laid the groundwork for the more formalized systems of medicine that would follow, but even as civilizations progressed, the deep-seated belief in the supernatural continued to influence the practices of ancient healers. The legacy of these first healers still lingers today in the plants, rituals, and spiritual practices used in alternative medicine. The roots of healing can be traced back to these early origins, where human survival was guided by a blend of wisdom, faith, and the inexorable connection between humans and the natural world. The practice of healing in the ancient world was not merely an act of applying herbs or bandaging wounds. It was deeply embedded in rituals that transcended the physical realm and ventured into the mystical. These rituals were the lifeblood of ancient healing practices, creating a connection between the healer, the patient, and the divine forces believed to control life and death. From the sacred halls of Egyptian temples to the dark caves where Celtic druids gathered, healing rituals were a central part of the ancient world's medical system. In ancient Egypt, healing rituals were inseparable from the spiritual realm, often intertwined with prayer and divine intervention. The sick were led to the grand temples of gods like Sekhmet, the lion-headed goddess of healing and war, where they would undergo purifications, sacrifices, and prayers. The rituals performed in these temples were as much about cleansing the spirit as they were about curing the body. It was believed that illness was the result of spiritual impurity, and so, to restore balance, the soul needed to be healed as much as the body. These healing ceremonies involved the use of sacred oils, resins, and incense, whose aromas filled the air and were believed to invite divine energies to the patient's side. Alongside these divine prayers were the physical treatments, the healing hands of the priests, the soothing effects of the herbs, and the soothing chants that echoed through the sacred spaces. Healing was not a solitary endeavour. It was a communal activity where the sick were surrounded by priestly healers who invoked divine powers and worked together to restore both the body and the soul. In Mesopotamia, rituals also took centre stage in the healing process. The ancient Babylonians and Sumerians placed great emphasis on the power of divine names, calling upon gods like Shamash and Ea to protect the sick from evil spirits and to cure diseases. Incantations were recited in unison by priests, creating a rhythm that was believed to drive away darkness and bring forth the light of health. These rituals could take days, sometimes even weeks, as the ill were guided through a series of spiritual and physical processes that ensured a return to balance. The healing process was always accompanied by symbolic acts, like the burning of sacred herbs or the placement of amulets made from sacred stones. The importance of ritual was not lost on the ancient Greeks, who carried these traditions forward in their temples dedicated to Asclepius, the god of medicine. The Greeks believed that healing came through the dreams of the sick, as they would sleep in the sacred Asclepius temples and receive divine guidance in their dreams. These temples became sanctuaries for those seeking healing, and the process was always a fusion of divine intervention and healing practices that involved herbs, physical treatments, and prayers. To be healed was to enter into a partnership with the divine, and the ancient Greeks, like the Egyptians and Mesopotamians, never saw healing as purely scientific but as an act that involved cosmic forces. This sacred knowledge, passed down through generations of healers, was an intricate balance between ritual and remedy. The healers themselves were considered intermediaries between gods and men, trusted with secrets that were thought to be divinely inspired. They carried with them knowledge of sacred plants, the divine names of gods, and the rhythms of the human body, creating a bridge between the physical and the spiritual worlds. It was not just the herbs they knew, or the surgical techniques they practiced that made them powerful. It was their connection to the unseen world, the belief that healing was a cosmic act, where every remedy was an echo of the divine order. The sacred knowledge passed down from generation to generation was not written in books but encoded in rituals and ceremonies that carried a deep sense of mystery. Are you ready to rediscover the forgotten practices that ancient doctors used to heal the sick? Dive deeper into the mysteries of ancient medicine and how their forgotten knowledge may hold answers for modern health challenges. Don't forget to like, subscribe, and hit the bell to explore more of history's hidden secrets with us. In the ancient world, the art of healing was deeply intertwined with nature's offerings. The healing power of herbs was not only a matter of chance, it was believed to be a divine gift, a secret passed down through generations of healers. From the dense forests of the ancient Celts to the sun-drenched deserts of Egypt, herbs were the most trusted tools in the healer's arsenal. Each plant was considered sacred, each leaf, root, or flower holding the key to life or death. The Egyptians, with their profound reverence for nature, used herbs in a variety of ways. The famous papyri of Ebers, a medical text from ancient Egypt, is filled with formulas containing a wealth of plants, including the potent aloe vera. Known for its healing properties, aloe was used to treat wounds, burns, and skin conditions, providing instant relief when applied. But it wasn't just aloe that had power. The Egyptians used frankincense and myrrh, resinous substances obtained from trees in the desert, to purify the air and ease respiratory issues. These sacred resins were not only used in healing but also in religious rituals, creating a deep connection between the medicinal and the spiritual. In Mesopotamia, the Babylonians and Assyrians also relied on plants to treat ailments. The ancient healing texts found in the ruins of Sumer and Assyria list numerous remedies using local herbs. The use of garlic, for example, was widespread in ancient Mesopotamia. Garlic was believed to have protective properties, often used to ward off evil spirits as well as to treat physical illnesses. In ancient India, the knowledge of herbs took on an entirely different but equally important role. Ayurveda, a system of medicine that dates back thousands of years, places herbs at the centre of its healing practices. Turmeric, with its golden hue and powerful anti-inflammatory properties, has been used for millennia to treat conditions from joint pain to digestive issues. Tulsi, or holy basil, was revered as a sacred herb, believed to have the power to purify the body and mind, strengthening the immune system and fighting off disease. The Chinese, too, were well versed in the healing properties of plants. Traditional Chinese medicine, TCM, is built upon the knowledge of herbs like ginseng, which was used to increase energy and stamina, and licorice, which was known to harmonize the body and enhance the effects of other herbs. But Chinese medicine took a more holistic approach, combining herbs with the flow of energy, or qi, throughout the body. By aligning the body's energy with herbal treatments, ancient Chinese healers were able to treat a wide array of conditions, from chronic illnesses to emotional imbalances. Across the world, from Europe to Asia, The healing power of herbs was seen as a connection to the divine. Every plant had its own spirit, and the healer's task was to understand this connection and use the plant's power to restore balance to the body. Herbs weren't just remedies, they were gateways to healing that extended beyond the body, influencing the mind and soul. These plants were not only the first medicines, but also the first form of universal wisdom, passed from healer to healer, generation to generation. As these herbal traditions spread across cultures, they formed the foundation for modern botanical medicine, proving that nature itself holds the answers to many of humanity's most enduring questions. The legacy of these early healers and their herbal knowledge still echoes today as more people return to natural remedies for healing. The line between divine healing and human knowledge in the ancient world was often blurred, creating a paradox that still fascinates us today. Were the ancient healers truly tapping into the wisdom of the gods, or were they simply observing nature and uncovering its secrets through trial, error, and divine inspiration? In many ancient civilizations, the answer was both. Ancient Egypt, with its deeply religious and mystical society, believed that healing came from the gods themselves. Imhotep, the legendary Egyptian physician, was not only a healer but a deity who was said to possess divine knowledge. The temples dedicated to gods like Sekhmet and Thoth were not just places of worship, they were centers of healing, where priests combined medical knowledge with sacred rituals. The healers in these temples were seen as intermediaries between the human realm and the divine, using a blend of sacred incantations and earthly remedies to cure ailments. The knowledge they passed down was thought to be inspired by the gods, with each remedy containing a divine essence that could only be unlocked through proper ritual. Yet, as we look closer, we begin to see the human side of ancient healing. It was not just divine favour or magical intervention that healed the sick, it was a deep understanding of the natural world. The ancient Egyptians, for example, meticulously studied anatomy, observed the effects of various herbs, and used this knowledge to treat everything from wounds to fevers. Their knowledge of the body was far ahead of its time, suggesting that these healers were not merely vessels for divine knowledge, but astute observers of the world around them. Similarly, in ancient Mesopotamia, the Sumerians and Babylonians did not rely solely on the gods for healing. They practiced early forms of diagnostic medicine. Medical tablets from this era show that they understood diseases, symptoms, and the importance of hygiene. These ancient cultures did not simply invoke the gods, they also worked to understand the mechanics of the human body. This blending of human knowledge and divine intervention was not unique to Egypt or Mesopotamia. In ancient Greece, the famous physician Hippocrates, who's often referred to as the father of modern medicine, was both a proponent of rationality and a believer in the influence of the gods. The Greeks believed that the gods had a hand in health and illness, yet Hippocrates advocated for observation and diagnosis over divine intervention. He rejected the idea that illness was purely a punishment from the gods, instead emphasizing the importance of understanding the body's humours and the environment's role in health. The question of divine healing versus human knowledge continues to be a complex and fascinating one. Even as early healers made significant strides in understanding anatomy, disease, and treatment, they were still deeply tied to spiritual practices that were beyond their scientific understanding. In many ways, the ancient healers worked as intermediaries, guided by the divine but grounded in the natural world. Their success was not purely magical or purely scientific, it was the result of their unique ability to combine the sacred with the practical, the divine with the human. This marriage of the divine and the natural was not only an essential part of ancient healing, but also a precursor to modern medicine, where faith and reason continue to coexist in various ways. The legacy of these ancient healers continues to influence modern practices, as we still draw upon both scientific knowledge and spiritual beliefs in our quest for healing. In ancient Egypt, the roots of medicine ran deep, intertwining with the very fabric of the civilization's spiritual and cultural beliefs. Egyptian medicine was far more than a set of techniques and remedies. It was a holistic approach that combined the mystical with the empirical, setting the stage for future medical traditions across the world. The Egyptians understood that health was not only the absence of illness, but a complex harmony between body, mind, and soul. The sacredness of their medical practices was reflected in the temples dedicated to gods of healing like Imhotep, the revered physician who became a deity himself. Imhotep's influence transcended his time, with the belief that his healing powers were bestowed upon him by the gods. It wasn't just divine intervention that made Egyptian medicine powerful. It was the knowledge they accumulated over centuries, a blend of practical observation and sacred knowledge. Ancient Egyptians were pioneers in the art of surgery, with evidence of trepanation, removal of part of the skull to treat head injuries, dating back to more than 5,000 years ago. They understood anatomy with a depth far beyond their era, performing autopsies to study the internal workings of the body. Their medical texts, such as the Ebers Papyrus, reveal a wealth of information on diagnosing diseases, preparing medicines, and performing surgical procedures. Remedies range from simple herbal treatments to complex rituals designed to restore balance within the body. The Ebers Papyrus, one of the oldest surviving medical texts, describes more than 800 remedies for various ailments, showing how deeply the Egyptians understood the healing properties of herbs, plants, and minerals. Their knowledge of medicinal plants was extensive. Garlic, for example, was used not only as a food but also as a cure for a range of ailments, from infections to digestive issues. Egyptians were also experts in using oils and resins for medicinal purposes. Frankincense and myrrh, resins obtained from desert trees, were used for their antiseptic and anti-inflammatory properties, helping to treat wounds, ease pain, and even purify the air. These substances were not just used in medicine, but also played a significant role in religious rituals, where the act of healing was as much a spiritual journey as a physical one. The Egyptians' ability to balance the sacred and the practical set the stage for the development of other ancient medical systems. Their influence spread through trade and conquest, leaving an indelible mark on cultures throughout the ancient world. Greek medicine, for instance, was profoundly shaped by Egyptian practices, particularly in the areas of surgery and the use of herbal remedies. The concept of healing as a divine act also found its way into Greek thought, with Asclepius, the Greek god of medicine, often depicted as an Egyptian-inspired figure. This blending of sacred and scientific knowledge laid the groundwork for the medical practices that would eventually influence the entire Western world. But perhaps the most enduring legacy of Egyptian medicine was the emphasis on holistic healing. The Egyptians understood that health was not simply about curing disease, but about maintaining balance within the body, mind, and spirit. Their approach to medicine was one that honoured the interconnectedness of all things, and this philosophy continues to resonate with us today. Ancient Egyptian medicine, with its deep reverence for the natural world and its pioneering medical practices, left a legacy that transcends time, influencing not only the ancient world, but also shaping the future of healing and medicine in ways that we are still discovering. In the ancient world of Babylon and Sumer, healing was a complex fusion of divine intervention and early scientific observation, setting the stage for the development of medical practices that would echo through the ages. The Babylonians and Sumerians, two of the world's first great civilizations, looked to the gods for answers to health and disease. Their understanding of illness was deeply rooted in their spiritual beliefs. To them, sickness was often a divine punishment or the work of evil spirits. Healing, therefore, was not just a matter of applying remedies. It required appeasing the gods and ensuring that balance was restored to the body and the universe. The Sumerians were among the earliest civilizations to record their medical knowledge. Their cuneiform tablets, written in clay, reveal a sophisticated understanding of various diseases and treatments. In these tablets, one can find references to everything from gastrointestinal issues to skin diseases, with detailed instructions for herbal remedies and dietary changes. But these texts also contain references to gods like Ninsa and Asaluhi, who are believed to intervene in healing, and they show how religious rituals were woven into medical practice. In ancient Babylon, the practice of medicine was highly structured, with specific roles for healers. There were Ashipu, exorcists, who dealt with spiritual afflictions, and Asu, physicians, who treated physical ailments. The Asu relied on their knowledge of herbs, animal products and minerals, but their work was always accompanied by invocations to the gods. The Babylonians, for example, used a wide range of plants, including myrrh and cassia, to treat wounds and infections, believing these substances held a divine essence that could purify the body. The Babylonians also utilized minerals like sulfur and bitumen in their treatments, showing an early understanding of how natural elements could be harnessed for healing purposes. These practices were not just about treating symptoms, they aimed to restore harmony within the body and the larger cosmic order. An important part of their healing process involved rituals, often conducted in sacred spaces, where offerings to the gods were made to ensure that healing occurred. In addition to divine remedies, the Sumerians and Babylonians understood the importance of hygiene and sanitation, which laid the groundwork for public health. The Babylonians had advanced drainage systems, and the Sumerians practiced cleanliness in their religious rituals, creating an environment conducive to health. These early civilizations also understood the importance of prognosis and diagnosis, although it was done through an interpretation of omens and dreams. The practice of examining urine, observing symptoms and interpreting the patient's condition was common, and Babylonian healers recorded their findings in detail, contributing to the early development of diagnostic practices. Despite the religious and mystical elements of their healing practices, the Sumerians and Babylonians were not entirely disconnected from the physical world. Their knowledge of medicinal plants and minerals was highly advanced for its time, and many of the treatments they used continue to be utilized in modern herbal medicine. They saw the body and the spirit as intertwined, where illness in one part could affect the other. This interconnected view of health is something that resonates in modern holistic approaches to medicine. As the Babylonians and Sumerians passed down their knowledge through generations, their influence spread across the ancient world, reaching as far as ancient Greece, where thinkers like Hippocrates were deeply influenced by their methods. Thus, Babylonian and Sumerian healers helped lay the foundation for future medical practices, blending divine beliefs with practical remedies and continuing to influence the healing arts long after their civilizations had passed. In the fertile intellectual soil of ancient Greece, a profound transformation was taking place, a shift from divine explanation to human reasoning in the realm of healing. Greek medicine marked the birth of rational thought, where mythological and supernatural explanations for illness were slowly replaced by a scientific observational approach. The gods of Olympus no longer ruled over health and sickness alone. Now, human reason, observation, and empirical evidence began to take their place. At the heart of this shift was Hippocrates, often called the father of medicine, who rejected the idea that disease was a punishment from the gods. He believed that illnesses had natural causes, and by observing symptoms the body could be understood in a way that transcended divine intervention. Hippocrates' theory of the four humours, blood, phlegm, yellow bile, and black bile, revolutionized the understanding of the human body and its health. He postulated that health depended on the balance of these humours, and any imbalance would result in disease. This theory, though later replaced, laid the groundwork for future generations of doctors to explore the body in a rational scientific manner. The Greek approach to medicine was a break from the past, as healers began to see the body as a system that could be understood through the natural world. They no longer relied solely on magic, religious rituals, or the appeasement of gods. Instead, they began to study the human body, observe its functions, and treat diseases with reason. The famous Asclepius temples dedicated to the god of medicine became centres of both spiritual healing and rational medical practices. While prayers were still said, The Greek healers used these temples as places of rest and recuperation, where patients could sleep and dream of divine intervention. However, it was in the waking world that the true progress was being made. Greek physicians began to document their observations, ensuring that medical knowledge was passed down and improved upon with each generation. These early Greek doctors emphasized the importance of hygiene, diet, and exercise as essential elements of health, principles that are still foundational to medicine today. Beyond Hippocrates, figures like Galen took Greek medicine even further, making significant advancements in anatomy and physiology. Galen's studies on the human body, based on dissections of animals, provided critical insights into how the body functioned. Though many of his findings were later proven incorrect, his emphasis on empirical observation and the dissection of bodies set a new precedent for scientific inquiry. Greek medicine also introduced the idea that a physician should not only treat the symptoms, but also seek to understand the underlying causes of illness. This shift in thinking from supernatural explanations to rational thought was one of the most significant advances in medical history. It laid the foundation for modern medical practices that are still rooted in evidence-based medicine today. By focusing on the natural world, ancient Greek physicians turned healing into a science, an endeavour grounded in observation, logic, and experimentation. This new approach to medicine was not without its challenges, as it was met with resistance from those who still believed in the power of the gods and supernatural forces. Yet the legacy of Greek medicine and its rational approach to healing endured, influencing the development of medical knowledge for centuries to come. The Greeks didn't just change the way medicine was practiced, they changed how the world thought about health, disease, and the human body, shaping the very foundation of modern medicine. The concept of the four humours is one of the cornerstones of ancient Greek medicine, shaping diagnosis and treatment for centuries. The four humours, blood, phlegm, yellow bile, and black bile, were thought to govern not only the health of the body, but also the very nature of a person's temperament. This theory, formulated by Hippocrates and later expanded by Galen, posited that the balance of these fluids within the body directly influenced one's health. Each humour was associated with a different element and season. Blood was linked to air and spring, phlegm to water and winter, yellow bile to fire and summer, and black bile to earth and autumn. The idea was simple yet profound. When the humours were in harmony, the body was healthy. When they were out of balance, illness followed. The four humours provided a way to diagnose illness not by examining the disease itself, but by interpreting the imbalance within the body's internal fluids. For instance, an excess of blood was thought to make a person sanguine, cheerful, optimistic, and energetic, but too much blood could lead to conditions like fevers or bleeding. On the other hand, an excess of yellow bile made one choleric, angry, impatient, and volatile, and could lead to digestive disorders or feverish states. Phlegm, when out of balance, caused a person to be melancholic, slow, calm, and prone to depression, and was believed to lead to respiratory conditions or excessive mucus production. Lastly, an excess of black bile created a person who was melancholic in the truest sense, deeply introspective, depressive, and withdrawn, and it was believed to cause illnesses such as gastrointestinal disorders or dark moods. To diagnose a patient, ancient Greek physicians would examine the patient's symptoms, temperament, and bodily excretions, such as urine, sweat, and feces, all in relation to these humours. A doctor might observe that a person suffering from excessive heat or fever likely had too much yellow bile, while a person with coldness or sluggishness might be treated for an excess of phlegm. In some cases, the treatment involved methods to rebalance these humours, such as bloodletting, vomiting, or purging, all aimed at restoring harmony within the body. Bloodletting, for example, was one of the most common treatments for an excess of blood, and it was believed that removing some blood from the body would bring the humour back into balance, thereby curing the patient's illness. Likewise, emetics or purgatives might be used to clear the body of excess bile or phlegm. The humoral theory was not just a medical practice, it was a way of understanding human nature. The Greeks believed that one's health, personality, and even destiny were shaped by the balance or imbalance of these humours. This idea laid the foundation for later developments in psychology and personality theory, with humoral theory influencing how we view human emotions and temperaments today. While modern medicine has long since moved past the four humours, their influence is still felt in the way we approach holistic medicine and balance in the body. Ancient Greeks and Romans did not view disease as an isolated event, but as a reflection of the larger balance of the universe, a perspective that has influenced many alternative and complementary medicine practices. The four humours may no longer be central to our understanding of health, but they represent a significant milestone in humanity's effort to understand the complex relationship between the body, mind, and the environment. Ancient surgeries remain one of the most fascinating and mysterious aspects of early medicine, often blending a deep knowledge of the human body with practices that now seem both daring and rudimentary. The evidence of ancient surgeries dates back thousands of years, and what is most striking is the skill and precision involved, especially when considering the limited tools and resources of the time. In Egypt, the medical texts such as the Edwin Smith Papyrus reveal a surprising sophistication in surgical procedures. This ancient text, dating back to around 1700 BCE, outlines treatments for head wounds, fractures, and dislocations with detailed instructions on how to examine, treat, and even dress wounds. The Egyptians were performing surgeries like trepanation, the act of drilling or scraping a hole in the skull, possibly to treat conditions like head trauma, or to release evil spirits believed to cause mental illness. They also used primitive forms of anesthesia, like opium, to dull pain during operations, a practice that demonstrates an understanding of the need to minimize the suffering of patients during such invasive procedures. Even though there were no antiseptics, the Egyptians used herbs and oils to sterilize and dress wounds, an early form of infection control. These procedures were not just simple hacks at the human body. They involved careful observation, diagnosis, and a growing understanding of human anatomy. In ancient Greece, the work of physicians like Hippocrates and Galen laid the groundwork for more complex surgical interventions. While Hippocrates is best known for his contributions to medical ethics and the theory of humours, Galen advanced the understanding of the body through dissection. Though Galen's dissections were limited to animals, they helped him map out the circulatory and nervous systems in ways that would influence surgery for centuries. Galen's detailed anatomical work provided the foundation for surgical practices, and his writings on surgery became a staple for physicians in Europe and the Islamic world for centuries. The Romans, too, excelled in surgery, with skilled practitioners performing life-saving procedures such as cataract surgery, caesarean sections, and the removal of tumours. The Roman surgeon Aulus Cornelius Gelsus, a renowned medical writer, documented surgical practices in his work De Medicina, describing everything from bone fractures to soft tissue injuries. The Romans developed specialised tools for surgery, some of which are surprisingly similar to those used in modern operations. The practice of surgery was not confined to the temples and medical academies. In the bustling streets of ancient cities, barbers also doubled as surgeons, performing minor surgeries like bloodletting, tooth extractions, and the treatment of wounds. Although these procedures lack the sterile environments we rely on today, they were essential to ancient medical practices, showing a resourceful approach to treating injury and disease. However, ancient surgery was not without risks. Without the benefit of antibiotics, many surgeries led to infections that were often fatal. Despite these challenges, the ancient world demonstrated a profound resilience, with physicians pushing the boundaries of their knowledge and expertise. The skill required for these surgeries was not just technical, but often involved an understanding of the human condition, the ability to assess risk, and a remarkable degree of patience. Though the ancient world lacked the advanced tools we use today, Their innovations and daring feats in the realm of surgery would shape medical practices for millennia. The legacy of their surgical knowledge and techniques continues to be studied and admired in modern medicine, reminding us that despite the limitations of their time, ancient surgeons were capable of extraordinary feats of skill and ingenuity. In the ancient world, the distinction between healers and shamans was often blurred, creating a fascinating intersection of spiritual and physical care. Healers were revered not only for their knowledge of plants, potions, and surgical techniques, but also for their deep connection to the supernatural. Whether in ancient Egypt, Mesopotamia, or the Americas, those who practiced healing were often seen as intermediaries between the earthly realm and the divine. The role of a healer was not limited to curing physical ailments alone. It was believed that disease had spiritual causes, and only through rituals, prayers, and invoking divine powers could the healer truly restore balance. Shamans, on the other hand, were deeply embedded in the spiritual fabric of their societies. They were not simply physicians, but were spiritual guides, communicating with the spirit world to diagnose and heal their patients. In many cultures, the shaman was also the community's religious leader, offering wisdom, guiding rituals, and serving as a bridge between the human world and the gods. For example, in ancient Mesopotamia, the distinction between the religious priest and the healer was often non-existent. The Ashipu was a class of healer priests who treated diseases that were thought to be caused by evil spirits or divine wrath. These healers performed exorcisms, used incantations, and made offerings to the gods to cure ailments. Similarly, in ancient Egypt, the role of the priest-healer was intertwined with religious duties. The Egyptian god Imhotep, considered the patron deity of physicians, was believed to possess both divine wisdom and the practical knowledge of healing. His followers, who were also priests, used a combination of ritualistic practices and natural remedies to treat the sick, seeking divine approval for their treatments through prayer and offerings. These healers were often also spiritual guides, helping the patient to restore their soul's balance as much as their bodies. The role of the healer as a spiritual figure is not confined to the ancient Near East. In other parts of the world, such as in the indigenous cultures of the Americas, Africa, and Asia, healers were similarly seen as spiritual figures who communicated with the unseen world to diagnose and treat illness. Shamans in these cultures underwent intense spiritual training, often involving isolation, meditation, and altered states of consciousness achieved through fasting, dancing, or using psychoactive plants. These experiences were believed to grant them access to the spirit world, where they could seek guidance from spirits and ancestors to heal their patients. In many of these traditions, healing was a process that involved the whole person, not just their physical body. Shamans understood that illness could manifest due to a spiritual imbalance, and healing required restoring that balance through ceremonies, chants, and the use of sacred herbs. The healer's ability to channel divine or spiritual forces was what set them apart from mere medical practitioners. They were not just knowledgeable about anatomy or herbalism, they had the power to intervene in the spiritual realm, bringing healing to the body, mind, and spirit. This powerful connection between the spiritual and physical worlds made ancient healers and shamans revered figures, not just for their knowledge, but for their perceived ability to connect with forces beyond human understanding. The blurred line between healer and shaman can still be seen in many modern healing practices that integrate spirituality, alternative medicine, and holistic approaches to health. Ancient traditions have shaped how we view healing today, reminding us that the path to wellness is often as much about the soul as it is about the body. In the ancient world, the line between medicine and religion was often indistinguishable. Healing was not just about treating the body, but about restoring harmony between the human soul and the divine. In many civilizations, illness was seen not as a biological issue, but as a punishment from the gods, or a manifestation of spiritual imbalance. Thus, religion played a central role in healing practices, with many cultures believing that only through divine intervention could true healing occur. In ancient Egypt, for example, gods like Thoth, the god of wisdom, and Sekhmet, the goddess of healing, were central to the medical practices of the time. Priests were not only healers but also intermediaries between the gods and humans. They would perform rituals, offer prayers, and make sacrifices to seek the favour of the gods, hoping that this divine intervention would cure the sick. Temples were often the centres of medical treatment, and the healers within these sacred spaces were considered to possess the divine knowledge required to restore health. Healing, then, was not just the application of remedies or the performance of surgery. It was a spiritual endeavour, and the patient's relationship with the divine was considered just as important as the physical treatment. In ancient Greece, healing also took on a religious dimension, especially in the temples dedicated to Asclepius, the god of medicine. These temples became pilgrimage sites for the sick, who would seek healing through prayer, ritual, and divine dreams. The process of healing in these temples involved a unique combination of spiritual practices and medical techniques. The sick would often sleep in the temple, hoping for divine dreams that would reveal the cure for their ailments. Priests would interpret these dreams and provide the necessary remedies, which could range from herbal treatments to physical therapies. This fusion of religion and medicine created a system where the divine was seen as intimately involved in the healing process. The role of religion in healing was not limited to the Egyptian and Greek worlds. In Mesopotamia, the Babylonians and Assyrians believed that illness was caused by evil spirits or the anger of the gods. The healing practices of these ancient cultures were deeply entwined with religious rituals. Exorcisms, prayers, and the invocation of gods were common methods of treatment. In some cases, the healing process was as much about appeasing the gods as it was about treating the patient's physical symptoms. Similarly, in ancient India, religion and healing were intertwined through the practice of Ayurveda. Ayurveda, one of the oldest systems of medicine, is based on the belief that the health of the body and the mind is closely connected to the balance of the individual's spiritual energy. Religious practices such as meditation, yoga, and prayer were seen as integral to the healing process. The ancient Indian sages believed that healing could not occur unless the person's spiritual energy was in harmony with the universe. These religious practices were not separate from medicine, but were, in fact, the foundation upon which healing was built. Even in ancient China, healing was viewed as a balance between the spiritual and physical realms. Traditional Chinese medicine, with its emphasis on qi, life force, and the balance of yin and yang, sees the body as a vessel that must be in harmony with the forces of nature. The use of acupuncture, herbal remedies, and qigong was seen not just as a way to treat physical ailments, but as a method of restoring spiritual balance. In all these ancient cultures, healing was never viewed as a purely medical or scientific endeavour. Instead, it was an intricate dance between body, mind, and spirit, where religious practices played a pivotal role in achieving health and wellness. The divine was seen as the ultimate source of healing, and the healer's role was to tap into this divine energy, restoring balance to the patient's life. This deep connection between religion and healing still reverberates today, as many modern alternative therapies continue to draw from ancient spiritual practices, reinforcing the timeless belief that true healing encompasses more than just the physical. In ancient Rome, medicine began to emerge as a more structured and refined practice, a blend of ancient knowledge, experimentation, and Greek influence. Roman medicine, while heavily rooted in earlier traditions, saw the emergence of specialized physicians who played a crucial role in the health of the empire's citizens. It was in Rome that the role of the physician as a professional became firmly established, laying the groundwork for modern medical practices. Roman physicians, unlike their Greek counterparts who were often philosophers, focused more on practical and diagnostic skills. They learned from Greek doctors but brought their own innovations into practice, particularly in the areas of surgery and public health. The Roman physician Galen, one of the most famous medical figures in history, greatly influenced the practice of medicine in the Roman world and beyond. Galen's approach to medicine was based on observation and empirical study. He conducted dissections on animals, primarily apes and pigs, which provided him with a deeper understanding of human anatomy, although he never dissected human bodies. His work laid the foundation for much of the anatomical knowledge of the time, shaping medical theory for centuries. Galen's influence extended well beyond his lifetime, and his texts became essential for training physicians throughout the Roman Empire. Roman physicians focused not just on treating the sick, but on prevention and general wellness. Roman society placed a great deal of importance on maintaining health through exercise, proper diet, and hygiene. Public baths, aqueducts, and sophisticated sanitation systems were all innovations that helped improve the public health of Roman cities. The Romans understood the importance of clean water and regular bathing, seeing these practices as essential for good health and hygiene. In addition to these public health measures, Roman medicine also saw the rise of specialized medical fields. Physicians were often categorized based on the types of treatments they provided, such as those who treated eye diseases, those who dealt with fractures and wounds, or those who focused on internal ailments. Surgery, once considered taboo, became more accepted and sophisticated, with Roman surgeons using a variety of tools for operations such as cataract removal and repairing fractures. The Romans even used rudimentary forms of anesthesia, such as opium, to dull the pain during surgery, a significant step in the development of medical procedures. One of the most significant contributions of Roman medicine was the development of military medicine. The Roman army, known for its discipline and organization, placed a great deal of emphasis on the health and well-being of its soldiers. Roman military hospitals, or valetudinaria, were established to treat injured soldiers, and battlefield surgeons were trained to perform quick and effective surgeries to save lives. The Roman army's focus on medical care was revolutionary, ensuring that soldiers were fit for battle and reducing the number of casualties. Roman medicine was not without its flaws, however. Despite the advances in surgery and public health, the Romans still relied on superstitions and rituals to treat certain ailments. Illnesses were sometimes attributed to the anger of gods or evil spirits, and sacrifices were made to appease these forces. Additionally, Roman physicians, much like their Greek predecessors, believed in the importance of the balance of humours, which could lead to unnecessary bloodletting or purging. Nonetheless, Roman medicine represented a significant step forward in the development of healthcare. The emphasis on specialization, public health, and the integration of scientific knowledge with practical medicine would set the stage for future advances in medical practices. Roman physicians and their innovations left an indelible mark on the history of medicine, influencing medical thought in Europe and the Islamic world for centuries to come. In ancient China, the practice of medicine was rooted in a holistic understanding of the body, where health was seen as the balance of opposing forces and the harmony between the body, mind, and nature. Central to Chinese medicine was the concept of qi, or life force, which flowed through the body along pathways called meridians. According to traditional Chinese beliefs, illness arose when there was an imbalance or blockage of qi, disrupting the body's natural equilibrium. Unlike the Western medical approach, which often separates body and mind, Chinese medicine viewed the two as inseparable, deeply connected through both physical and spiritual elements. The primary aim of Chinese medicine was not simply to treat symptoms, but to restore balance and harmony within the body, thereby preventing disease and promoting long-term wellness. This philosophy led to the development of a range of practices designed to adjust the flow of qi and harmonize the body. Acupuncture, one of the most well-known aspects of Chinese medicine, is based on the idea of inserting thin needles into specific points along the body's meridians to unblock or redirect the flow of qi. The practice was believed to stimulate healing and restore balance, addressing not only physical ailments, but also mental and emotional conditions. This therapeutic technique, which dates back thousands of years, is still widely practiced today, demonstrating the lasting power of traditional Chinese healing. In addition to acupuncture, Chinese herbal medicine formed a core component of ancient healing practices. Ancient Chinese texts, such as the Shenongbenkao Jing, the classic of herbal medicine, catalogue the healing properties of hundreds of plants, minerals, and animal products. Herbs like ginseng, which was used to boost energy and immune function, and dong quai, known as the female ginseng for its ability to regulate menstrual cycles, became staples in the Chinese pharmacopoeia. These natural remedies were often combined into complex formulas, designed to address specific imbalances within the body. Unlike the singular remedies of Western medicine, Chinese herbal medicine involved careful balancing of ingredients to work in harmony with each other, taking into account a person's unique constitution, the season, and the environmental factors that could influence health. Qigong, a practice of movement, meditation, and breath control, was another crucial part of Chinese medicine. It focused on cultivating and enhancing the flow of qi through the body, with practitioners using slow, deliberate movements and controlled breathing techniques. The goal was to enhance health, vitality, and longevity by ensuring that the qi flowed freely throughout the body. These practices, rooted in Taoism and other Chinese philosophies, underscored the importance of cultivating internal harmony, a theme that was consistently emphasized in all aspects of Chinese medical thought. Traditional Chinese medicine also placed a great deal of emphasis on diagnosis through observation and palpation, rather than laboratory tests. Physicians would examine the patient's tongue, listen to their pulse, and assess their overall demeanor to determine the underlying causes of illness. This diagnostic process was not just about identifying the symptoms, but understanding the root causes of disharmony within the body. This thorough and personalized approach to diagnosis helped ensure that treatment was tailored to the individual, taking into account not only the physical symptoms, but also emotional and spiritual factors that might contribute to illness. Over the centuries, Chinese medicine evolved, incorporating elements from Buddhist, Taoist, and Confucian philosophies, and spreading its influence far beyond China's borders. Today, traditional Chinese medicine continues to thrive globally, with acupuncture, herbal treatments, and Qigong still offering alternative healing methods for those seeking a more holistic approach to health. The enduring legacy of Chinese medicine lies in its ability to integrate the physical, mental, and spiritual aspects of health, reminding us that true wellness comes from achieving harmony within the body and with the natural world around us. The so-called Dark Ages, stretching roughly from the fall of the Roman Empire to the beginning of the Renaissance, are often viewed as a time of stagnation in medicine and knowledge. For centuries, the achievements of ancient civilizations seemed to vanish from Western Europe. Medical practices regressed, overshadowed by superstition, religious dogma, and the widespread belief that illness was a punishment from the gods. Yet, this view of the Dark Ages as a time of decline is an oversimplification. While it is true that Europe was politically fractured and the preservation of ancient knowledge became a challenge, medicine did not simply vanish. Rather, it transformed in response to new religious and cultural paradigms. With the collapse of Roman institutions, much of the medical knowledge that had been carefully documented in the past was lost or forgotten. The destruction of libraries, the fall of trade routes, and the scarcity of skilled physicians led to a period where healing was often left to monks, herbalists, and midwives. However, the influence of Christianity played a crucial role in preserving and adapting medical knowledge. Christian monasteries became the repositories of ancient wisdom, where monks meticulously copied the medical texts of the Greeks and Romans. These texts, although occasionally misunderstood or misinterpreted, remained the foundation of medical practice during the early Middle Ages. The Church's role in health was paradoxical. It both stifled and nurtured the development of medical thought. On one hand, Church doctrine often limited the exploration of certain medical ideas, especially those that conflicted with religious teachings. On the other hand, monasteries provided safe havens for the knowledge of healing, where herbs, treatments, and remedies were carefully studied and preserved. The Church also introduced the idea of divine healing through prayer and miracles, which became a key aspect of medieval healthcare. While the Church championed prayer as the ultimate form of healing, it also encouraged the use of medicinal plants and herbs, which were seen as gifts from God. The focus shifted from purely scientific medicine to a more spiritual form of healing, where the soul's health was just as important as the body's. The healing powers of saints, relics, and holy water became central to medieval medicine. Despite this, the Dark Ages were not entirely devoid of progress. In the Islamic world, scholars and physicians were actively preserving and expanding upon the knowledge of ancient civilizations. Figures like Avicenna, whose medical encyclopedia, The Canon of Medicine, became the standard reference for centuries, helped bridge the gap between ancient wisdom and the later development of modern medical science. Avicenna's work not only preserved the Greek and Roman teachings, but also introduced new concepts, particularly in the fields of pharmacology and diagnosis. His influence would later spread to Europe, reawakening interest in the scientific methods of ancient medicine. In addition to the work of Islamic scholars, various medical practices continued in rural villages and among folk healers. Herbal medicine, developed through centuries of trial and error, remained a mainstay for treating ailments, even as formal medical institutions declined. These practices would later influence the Renaissance revival of scientific inquiry. Though the Dark Ages may have seen a slowing down of medical advancements in Western Europe, it was not a time of complete decline. Instead, it was a period of transformation, where ancient knowledge was adapted to new cultural and religious contexts, and where healing continued, albeit in ways that were often intertwined with spirituality. The so-called Dark Ages ultimately laid the groundwork for the eventual resurgence of medicine during the Renaissance, where a renewed focus on observation, experimentation, and humanism would pave the way for modern science. During the Islamic Golden Age, a period stretching from the 8th to the 14th centuries, a cultural and intellectual renaissance flourished in the Middle East, leaving an indelible mark on the development of medicine and scientific thought. In this golden era, scholars in the Islamic world took on the critical task of preserving, translating, and advancing the knowledge of ancient civilizations, particularly the Greeks, Romans, and Persians. This preservation and synthesis of knowledge not only saved valuable texts that might otherwise have been lost, but also expanded upon them, laying the foundation for many of the advancements that would later characterize the Renaissance in Europe. The scholars of the Islamic world did not simply preserve knowledge, they built upon it. One of the most influential figures of this period was Avicenna, Ibn Sina, a Persian polymath whose comprehensive medical encyclopedia, The Canon of Medicine, became the standard medical text in both the Islamic world and Europe for centuries. His work was groundbreaking, integrating the medical knowledge of the Greeks, such as the humoral theory, and enhancing it with his own observations and original ideas. Avicenna made significant strides in pharmacology, introducing new classifications of drugs and emphasizing the importance of accurate diagnosis. His concepts of contagion and the transmission of diseases through physical contact or air were ahead of his time, contributing to the development of epidemiology. At the same time, Al-Razi, Rhazes, another prominent figure in the Islamic Golden Age, was making his own contributions to the field of medicine. He is credited with discovering sulfuric acid and distinguishing smallpox from measles, an achievement that was monumental in understanding infectious diseases. Al-Razi's approach was empirical and experimental. He advocated for the careful observation of patients, documenting their symptoms and responses to treatments. His medical writings laid the groundwork for future generations of doctors and surgeons, promoting an evidence-based approach that would eventually influence European medicine. The hospitals of the Islamic world during this period were far ahead of their time. Known as bimaristans, these hospitals served not only as places of medical treatment, but also as centres of learning and research. Physicians, nurses, and scholars worked together to treat patients, conduct research, and educate the public. The bimaristans were well equipped with libraries, lecture halls, and lecture rooms where medical texts were taught and discussed. They also introduced the concept of mental health care, with specialised wards for patients suffering from mental illnesses, an acknowledgement of the complexity of human health that was ahead of its time. In addition to the advancements in clinical medicine, Islamic scholars made significant contributions to surgery. Instruments such as scalpels, forceps, and catheters were refined and developed during this period, many of which were used for centuries in Europe. Surgeons like al-Zahrawi, Abulcasis, wrote detailed texts on surgical techniques, some of which were translated into Latin and became essential for European medical training. The advancements made in surgery and anatomy during the Islamic Golden Age played a pivotal role in the development of Western medicine, introducing the scientific community to new techniques and an understanding of human anatomy that had previously been lacking. The preservation of ancient texts and the creation of new knowledge laid the foundation for a broader, more comprehensive understanding of human health and disease, and helped to restore the scientific inquiry that would later fuel the European Renaissance. The contributions of the Islamic world were pivotal not only in advancing medicine, but in shaping the course of scientific history. As Europe began to emerge from the Dark Ages, the knowledge preserved and expanded by Islamic scholars would influence the great physicians, scientists, and thinkers of the Renaissance, furthering the evolution of medicine in profound ways. During the medieval period in Europe, healing was a complex intersection of mysticism, folklore, and rudimentary medical practices. The collapse of the Roman Empire had resulted in a fragmentation of knowledge, and with it, much of the advanced medical understanding of the ancients was lost. For centuries, the Catholic Church held significant sway over all aspects of life, including medicine. Healing practices were influenced heavily by religious beliefs, and the Church was at the centre of both spiritual and medical care. Many medieval European healers, whether they were monks, nuns, or village herbalists, performed their roles within the religious framework, seeing their healing work as part of God's divine plan. But as much as faith played a role in healing, there were also attempts to preserve and build upon the medical knowledge of the past. Monasteries and abbeys became the main repositories of knowledge, where manuscripts containing the works of ancient Greek and Roman physicians such as Hippocrates and Galen were carefully copied and studied. While the Church often emphasized divine healing through prayer, holy relics, and miraculous cures, there were some healers who also relied on practical knowledge drawn from these ancient texts, herbs, and local remedies. The combination of religious rituals and the occasional use of medical practices gave rise to a hybrid of healing that we now associate with medieval medicine. Healers often turned to prayer and the invocation of saints to cure diseases, especially those thought to be caused by demonic forces or divine punishment. In this environment, the concept of illness was often supernatural. The idea that diseases were caused by the wrath of God, evil spirits, or the influence of witches was widespread. As a result, many healers used a combination of herbal treatments and exorcisms or rituals to cure their patients. However, despite these superstitions, medieval healers also laid the groundwork for the scientific practices that would later define medicine. Apothecaries and herbalists worked tirelessly to concoct potions, tinctures, and salves using herbs, plants, and minerals. The use of plants such as lavender, rosemary, and sage in treatments can be traced back to this period. These healers were often the first to experiment with natural remedies, observing their effects on the body and passing down their knowledge through generations. The great challenge for medieval European healers was reconciling the realms of belief and science. Many saw their healing practices as an extension of their faith, but others began to question the purely supernatural explanations for disease. One notable example was the rise of the universities in the 12th and 13th centuries, where scholars began to question the Church's influence over medicine. The University of Bologna in Italy, for example, became a centre for the study of human anatomy, with medical students gaining first-hand experience with cadavers. While dissection was still limited due to religious restrictions, the examination of human bodies was an important step toward the more scientific approach to medicine that would come later. Still, there was a deep reluctance to embrace purely scientific methods. Instead, many healers combined the religious aspects of care with practical treatments, often relying on spiritual rituals to accompany their herbal or surgical practices. This blend of myth and medicine created a unique healing landscape in medieval Europe, where healing was not just about curing the body, but about attending to the soul as well. As a result, medieval medicine can be seen as both a time of regression and advancement, where belief systems and practices rooted in ancient superstitions mixed with new understandings of the human body, setting the stage for the eventual transformation of medicine in the Renaissance. The Renaissance, a period of revival and intellectual flourishing, marked a dramatic shift in how humanity viewed the world, especially in the realm of science and medicine. The centuries of stagnation and superstition during the Dark Ages began to dissipate, giving way to an era that reconnected with the ancient wisdom of Greece and Rome, yet also introduced bold new ideas and methods. In the world of medicine, the Renaissance was not just a revival of old knowledge, but a rebirth that integrated humanism, scientific curiosity, and empirical observation. One of the most significant changes was the humanist belief in the potential of human beings to understand and control nature. This shift was evident in medicine, where doctors began to prioritize direct observation and study over the reliance on dogma and superstition. The Italian anatomist Andreas Vesalius played a pivotal role in this transformation. His groundbreaking work De Humani Corporis Fabrica, on the fabric of the human body, published in 1543, revolutionized the study of human anatomy. Vesalius performed dissections of human cadavers, a practice that had long been taboo in the West. By carefully studying the human body firsthand, Vesalius corrected many anatomical inaccuracies that had persisted since ancient times, particularly those propagated by Galen, whose influence had dominated medicine for over a millennium. His work was not just about improving anatomical knowledge, it was about fostering a new scientific approach to understanding the human body. Vesalius's contributions were pivotal in shifting medical practice away from theoretical and religious explanations to a more empirical, observational model. In addition to Vesalius, other great figures of the Renaissance contributed to the rebirth of medicine. William Harvey, an English physician, discovered the circulation of blood, a fundamental breakthrough that changed how physicians understood the cardiovascular system. In his Exercitatio Anatomica de Motu Cordis et Sanguinis, on the motion of the heart and blood, published in 1528, Harvey demonstrated that the heart functioned as a pump, circulating blood throughout the body in a continuous loop, debunking centuries of misconceptions. This discovery was revolutionary, offering concrete evidence for the function of the circulatory system and dramatically changing how physicians approach diagnoses and treatments. Alongside these anatomical breakthroughs, Renaissance medicine saw a growing emphasis on the importance of public health and hygiene. The bubonic plague, which had ravaged Europe for centuries, had profound impacts on the Renaissance mindset. The recurring plagues led to a renewed interest in sanitation, quarantine, and the prevention of infectious diseases. Although germ theory was not yet fully developed, the idea that cleanliness and isolation could prevent disease began to take hold in public health policy. Hospitals, too, saw improvements during this time, becoming more organized and focused on treating a variety of illnesses, not just those associated with the rich and powerful. The Renaissance also saw the advent of medical schools that emphasized empirical research, experimentation, and the use of the scientific method, pushing for a shift away from superstition and towards evidence-based practices. Universities such as those in Padua, Montpellier, and Bologna became hubs of medical learning, where scholars and students rigorously debated, tested, and refined medical theories. This intellectual environment fostered a new breed of physician, one grounded in both classical learning and an emerging understanding of the natural world. The works of Renaissance physicians were not confined to Europe alone. They spread across the globe, The influx of text from the Islamic world, along with the rediscovery of classical Greek and Roman texts, allowed for the exchange of knowledge that transcended national and cultural boundaries. The Renaissance thus set the stage for the modern age of medicine, where scientific inquiry, not religious doctrine, would drive progress. In this way, the Renaissance was not merely a revival of old ideas, it was the beginning of a new era, where observation, evidence, and experimentation would shape the future of medical practice for centuries to come. The shift to modern medicine marked a pivotal moment in human history, where centuries of tradition, superstition, and rudimentary healing methods began to give way to evidence-based practices, scientific discovery, and a more systematic approach to health and disease. This transition, which gained momentum during the 17th and 18th centuries, was characterized by the rise of new technologies, medical theories, and philosophies that revolutionized the way we understand the human body. It was during this period that the foundations of modern medicine were solidified, driven by groundbreaking advancements in biology, chemistry, and technology. One of the most significant milestones in this shift was the discovery of the circulatory system by William Harvey in the early 17th century. Harvey's demonstration that blood circulates through the body, pumped by the heart, fundamentally changed the way physicians understood cardiovascular health. His work laid the groundwork for future studies on the circulatory system and inspired a wave of research into the body's internal mechanisms, leading to the development of more accurate diagnostic methods. This newfound understanding of anatomy and physiology set the stage for a more scientific, rational approach to medicine. By the late 18th century, the development of microscopes by pioneers like Antony van Leeuwenhoek and Robert Hooke opened new frontiers in medical science. The ability to examine microorganisms and cells allowed for the identification of bacteria, viruses, and other pathogens that were previously invisible to the naked eye. This discovery revolutionized our understanding of disease transmission and led to the germ theory of disease, which would later transform medical practices worldwide. The idea that diseases were caused by microscopic organisms rather than imbalances in the humours or divine punishment was a radical shift that would have profound implications for public health, hygiene, and infection control. The rise of anesthesia in the 19th century further accelerated the shift toward modern medicine. Before its invention, surgery was often a terrifying and painful ordeal, with patients enduring excruciating pain while being cut open. However, the discovery and use of ether and chloroform in surgical procedures changed the landscape of surgery, making it more humane and precise. Surgeons were now able to perform complex procedures that had previously been unthinkable, leading to advancements in everything from trauma care to organ transplants. The introduction of antiseptics, spearheaded by figures like Joseph Lister, who championed the use of carbolic acid to sterilize surgical instruments, further reduced the risk of infection, improving patient outcomes and survival rates. The growth of hospitals and medical institutions, along with the establishment of public health systems, was another key factor in the transition to modern medicine. In the 19th century, the professionalization of medicine saw the rise of medical schools, standardized training, and the establishment of licensing bodies. Physicians were no longer amateurs or self-taught healers. They were trained professionals who adhered to rigorous standards of practice. This led to a more systematic approach to diagnosis and treatment, based on scientific principles rather than folklore or superstition. Public health measures such as vaccination campaigns and sanitation improvements became integral to modern medicine, dramatically reducing the spread of infectious diseases like smallpox and cholera. The shift to modern medicine wasn't just about technological advancements. It was also a change in how society viewed health and illness. The scientific method replaced magical thinking, and medical practice became a profession grounded in empirical research, experimentation, and evidence. As the 19th century progressed, the rapid advancements in medical knowledge set the stage for the early 20th century's explosion of breakthroughs in surgery, pharmacology, and disease prevention. The foundations of modern medicine were firmly laid, and the world would never be the same again. In today's rapidly advancing world, there is a growing movement that seeks to rediscover and integrate ancient knowledge into modern medical practices, embracing holistic approaches to health and well-being. As we stand at the crossroads of cutting-edge technology and age-old wisdom, the rediscovery of ancient healing methods offers an intriguing fusion of science and spirituality. The re-emergence of practices like acupuncture, herbal medicine, and mindfulness meditation reveals how ancient civilizations had a deep understanding of the body's connection to nature and its capacity for self-healing. As modern medicine has advanced with surgical precision and life-saving treatments, many people are turning to the wisdom of the past to complement and balance their approach to health. One of the most significant areas of rediscovery is in the use of plants and natural remedies. The healing properties of herbs, which were once central to ancient healing traditions, are now being revisited with a scientific lens. Research in pharmacology has shown that many plants used in traditional medicine contain compounds with powerful therapeutic effects. For example, the use of turmeric in ancient Indian Ayurvedic medicine has been shown to have anti-inflammatory and antioxidant properties, and ginger, used for centuries in both Chinese and Western traditions, is now recognized for its ability to reduce nausea and improve digestion. As we uncover the medicinal potential of these plants, we are reminded that nature has long provided the tools for healing. Another powerful example of ancient wisdom making a comeback is the practice of acupuncture, which has been used in China for over 2,000 years. Initially viewed with skepticism in the West, acupuncture has gained increasing acceptance as studies show its effectiveness in treating pain, stress, and a variety of other conditions. The traditional Chinese concept of qi, or life force, which flows through the body along meridians, is now being explored through the lens of modern science, with researchers investigating how acupuncture might influence the nervous system, enhance circulation, and modulate the body's innate healing mechanisms. In the realm of mental and emotional health, ancient practices like yoga and meditation, long integral to Indian and Buddhist traditions, have become mainstream methods of promoting mental wellness. Scientific studies have demonstrated the profound effects of meditation on the brain, including reducing stress, improving concentration, and enhancing emotional regulation. As we seek ways to address the mental health crisis in the modern world, these ancient practices provide valuable tools for achieving inner peace and balance. Furthermore, the modern resurgence of interest in ancient healing practices can be seen in the growing popularity of integrative medicine, which combines the strengths of both conventional and alternative therapies. More and more healthcare providers are recognizing the value of incorporating holistic approaches that address the whole person, body, mind, and spirit into their treatment plans. This shift reflects a broader cultural movement that acknowledges the limitations of focusing solely on symptom-based treatments and emphasizes the need for preventive care, emotional well-being, and lifestyle changes. The ancient knowledge we are rediscovering is not a mere relic of the past. It is a testament to the enduring wisdom of civilizations that understood the complex and interconnected nature of health. By embracing this knowledge, modern medicine can evolve in a way that honors both scientific innovation and ancient healing traditions. As we continue to explore and integrate the insights of our ancestors, we may find that the key to optimal health lies not in choosing one path over the other, but in blending the best of both worlds. A marriage of modern science with the timeless wisdom of ancient healing practices. Ancient doctors once held the secrets to life-saving practices, blending medicine with the mystical and laying the foundation for modern medicine. As we've seen, their wisdom wasn't just magic. It was an early glimpse into the science that would one day shape our world. Perhaps there is still more to uncover in the shadows of history. Keep exploring, keep questioning, and who knows what truths may lie hidden in the past waiting to be rediscovered. Until next time, stay curious.